with older, financially secure HIV-positive men taking advantage of young girls. KwaZulu-Natal has the highest HIV prevalence in the country.
Young girls having sexual contact with older people. You can see along the way that females have higher risk of HIV compared to males, and males start catching up towards the later ages, 45 years and above.
The highest prevalence is among women between the ages of 35 to 39.
Provinces such as KwaZulu-Natal, Free State, Eastern Cape and Mpumalanga still have the highest prevalence of HIV, ranging from 18.7 to 21.8.
The prevalence of HIV in the country has decreased from 2017.
It's impressive, the prevalence decline of 1.3% for all ages, 2.4% for adults 15 and older is notable. And as Professor Khangelani noted, this is multifactorial.
Health authorities are focusing on key areas.
We are targeting very specific populations that are affected with high impact interventions in order for us to turn the tide. UNAIDS, in their advice around effective HIV responses, they actually speak to 4 things, and one of them is follow the science and follow the data. So I think South Africa is following the science. If you look at our program data, it is showing that we do need to focus on adolescents and young people.
Almost 8 million South Africans were found to be living with HIV in 2022.
All right, we speak to Professor Khangelani Zuma, Divisional Executive in the Public Health Societies and Belonging Research Division in Human Sciences Research Council. Prof, a very good afternoon to you. Thank you so very much for joining us here on SABC News, sir.
Good afternoon, and thank you for inviting us.
All right, so let's talk about the two sort of, I would think, main issues that came out of the report. It stated that there's a general decrease in HIV prevalence, but on the other hand, the study also reveals a higher prevalence among women. Can you explain those findings for us, please?
Yes. Thank you very much. The lower prevalence or the decline in HIV prevalence is actually could be attributed to a number of factors. One of them is the more people being put on treatment and therefore being virally suppressed, and therefore with an undetectable virus and less likely to transmit the virus. So, however, the higher prevalence of HIV among women also could be due to women also living longer, because they are on treatment. And also a number of years and research has shown, as we know, that there's a higher risk of HIV transmission from males to females than the other way around. And that's just because of our biological makeup with the higher transmission rates from males to females. And that is why the prevalence remains high among women compared to males. But we need to note that HIV prevalence among males start catching up among males that are 35 years and above, and also among young females. The prevalence of HIV, especially among young females, matches that of males who are roughly 10 years older than them.
And in fact, I want to go there, Prof. Yeah, Prof, I really want to stay on that particular issue. Sorry to interrupt you there. But, you know, when you're talking about the fact that, you know, this report, of course, talks about that men catch up, as you've also put it later on. Does this then mean that, you know, women become, I mean, I'm trying to give another dynamic to perhaps the situation, and I'm sure you've looked into it yourselves. But does this then also mean that women become sexually active earlier in life, or perhaps that, you know, they encounter older men early who then affect them? Is this also what, you know, was perhaps highlighted?
The latter is the most common phenomenon.
All right.
Young women between the ages 15 to 24, they tend to have sexual contact with males that are 10 years older than them. And if you look at the statistics, if, for example, young women between the age 15 to 24 were having sexual contact with boys within the same age group, the prevalence of HIV among them would be much lower than this. But if you look at the statistics, the prevalence among women between ages 15 to 24 years compares very well with the HIV prevalence among males that are 10 years older than them. So you find that young women start having sexual intercourse with older males, they become infected. As they grow, at some stage, they'll get married, for example, or they settle with males, maybe within their same age group, who most likely would be HIV negative. Then they get infected at that stage, and that is why then you see males then catching up much later.
Yeah. I heard there during that a report by one of your colleagues there talking about the fact that we need to really worry about young people in general and focus on young people. Where does one begin? I mean, clearly your report shows the problem and shows the situation, but now, you know, it's really a case of addressing, this problem.
A number of them, young people, we saw in the study that actually they had the highest participation rate in the study compared to any other age group. But most of them, or few of them, were actually on ARVs. And they were the lowest in terms of the proportions of people who were virally suppressed. That is, people who've got less than 1,000 copies per milliliter of the virus. Now, that is where we need to start. We need to make sure that we put these young women, first of all, they need to get tested, they need to know their HIV status, and they need to be put onto treatment. And the results show very clear that once people are put on treatment, 94% of them get to be virally suppressed. And then they actually are less likely to transmit the virus to other people. So that is where we need to start. But the second most important thing is to be aggressive in terms of our behavioral communication information. We need to constantly ensure that we promote condom use, we educate people about the risk of HIV, which is still with us right now. The fact that people are put on treatment, it does not mean that now we can stop all other interventions. We need to use all the possible interventions that we can put to deal with the epidemic once and for all.
Yeah, and talking of that, you know, as we are about to commemorate World AIDS Day on the 1st of December, I want us to talk about some of the strides made thus far. And it seems that we've done well as a country when it comes to dealing with HIV and AIDS. I think there was a conference recently, if I'm not mistaken, in Durban, where, you know, a lot was spoken about in terms of, you know, the strides that have indeed been made. So it's not just, you know, doom and gloom. And certainly you highlighting in your report the fact that there is a general decrease, and that is obviously something to celebrate. I mean, since I think it was, your report says since 2017 there's been that general decrease. So let's talk about, you know, those strides that have been made.
The country, it's true, the country has made great strides, especially the level at which we as a country have been aggressive in putting people on treatment. And we can see that the results are actually showing up. We can see that we're turning the decline in prevalence in HIV. It does not have anything to do much with the mortality due to HIV, but it's because more people are born HIV negative now, adding onto the denominator. So it's population growth of people that are HIV negative. And also the graph, as we've just shown, which shows an aging epidemic. So these are all good news. We've really made great progress in dealing with the HIV epidemic. But of course, there are still those pockets of HIV that we need to deal with decisively, because if we don't, then we'll continuously be dealing with the epidemic. That if we invest more and be more aggressive, then we could be able to actually wipe it out in the next 5 to 10 years as we want, as per our targets.
Prof, it was a pleasure talking to you. Thank you very much for the work that you do. That is Professor Khangelani Zuma, of course, representing the Human Sciences Research Council. He's with the Society's Belonging Research Division.